Hi, I'm here with Ford Gilbert today, the founder of Trina Healthcare and the developer of the artificial pancreas system technology. We're going through a series of questions. This is my last question today I want to ask Ford, but it's a very important question. We talked a lot about the technology, and now we're trying to talk a little bit about scope of the technology and who will really benefit from this. So Ford, one of the questions I have asked me all the time is, does this work with both type 1 and type 2 diabetes?
Yes, it's a surprise to us in a real sense, but it turns out that the core problem of diabetes, again, is the inability to burn sugar, the inability to burn carbohydrates. Mm-hmm. And that core problem exists in both type 1 and type 2. Now, the two diseases are very dissimilar. As you know, type 1 is where the pancreas's islets of Langerhans have been wiped out, and so you don't produce insulin at all, although there are a few cases where there's residual pancreatic function that drive you crazy as a clinician. But by and large, type 1 patients don't produce any insulin, and type 2 patients start out and they start producing prodigious amounts of insulin. And yet they both have the same outcome. They don't burn sugar, and they don't burn carbs, in other words. Now, why is that? Well, because the liver is very tuned to the pancreas, it needs two signals. It needs the presence of glucose in the portal vein that goes to the liver, and it needs pulses of insulin. Now, in type 1, because you don't have any insulin production, of course you don't have any pulses of insulin. In type 2, you have insulin, but unfortunately, because the pancreas is trying so hard to overcome endogenous insulin resistance, so these type 2 patients have insulin resistance. The pancreas tries to keep up with that insulin resistance by producing more and more insulin, and when it does, it loses that signal that is a prerequisite to burning sugar correctly. So type 1 and type 2 diabetic patients, totally dissimilar disease, and yet they have precisely the same secondary outcomes. Why is that? Because the core problem is the same for both, which is if you're not burning sugar, you're not burning carbohydrates, then you're burning fats and free fatty acids and proteins, and that is destructive after a time. So these poor patients, whether they're type 1, which is about 10% of the patients, or type 2, which is about 90% of the patients, they have exactly the same problem. Fortunately, and somewhat surprisingly I have to admit, the same treatment works for each of them, because all we're doing is we're stimulating the liver to produce the enzymes that are necessary for proper carbohydrate metabolism, so that all the little mitochondria in the cells of these patients have the enzymatic pathways that allow them through what maybe you've heard as the Krebs cycle or the fructose cycle, or you may have heard it as phosphorylation or 6-phosphorylizing. All of those things mean the same thing. You burn sugar directly if you can, but if you can't, you have to burn fats. When you burn fats, you have problems.
So just to ask a little more detail, I have some friends who have a child who's a great athlete. He's 14 years old, and he has type 1 diabetes.
Okay.
Would someone like this be a candidate who has neuropathy at this young age?
Oh, of course.
Yeah.
We started my daughter at age 6. The only reason we did her, of course, was she was incredibly brittle. But the same process of being able to store and release glycogen is missing in that young boy, or young man, I guess, at 14. And also, his muscle glycogen is not nearly as well deposited or available. So he doesn't quite have the muscular ability. We have some lovely graphs to show that. They're just slightly lower than normal when they're at hard exercise, but when they're at rest, they're wildly lower than normal. And unfortunately, as you probably know, you can only exercise so much during the day. So you get a little bit more normal-like when you're exercising, but it doesn't follow over and keep you when you're not exercising. So this patient would benefit greatly. Number one, if he's got neuropathy, that tells you that his nerves are having trouble conducting the signals. And what happens with neuropathy is that signal is delayed or intercepted, and when that signal is delayed, they say, oh, there's something wrong, there's pain here. Well, that's why they call it painful neuropathy. Sometimes it's just tingling. Sometimes it goes through a painful stage. Sometimes it goes almost straight into a stage where you cannot feel. But this is all the same problem. It's all the same problem in the brain and in all the nerves, even for those people who have a gastroparesis, where they don't metabolize, they don't eat well, and then their foodstuffs get literally caught in the chambers of the stomach. All of those are nervous system problems. And the nerve only uses glucose. So if you are glucose impaired in your ability to process carbohydrates, then one of the first things that's going to be infected is the nerve, including brain tissue. So this young man that you're speaking of, obviously he's very affected, as are many people with this disease. I think upwards of 60% of all diabetic people eventually get neuropathy. And that makes a lot of sense because their brain and their nerves don't get enough energy. So when you're burning fat, you only get roughly 65% of the energy you do when you're burning carbs. Plus, you have to use extra oxygen to burn fat. So not only are you getting less energy to the cells and thereby less energy to these nerve cells that need it, but you're also requiring them to draw on more oxygen. And that is a big problem also, which is why in many respects cardiac myopathy is so prevalent in these type 2 diabetic people, because what happens is their heart is literally starving, as is the rest of their body, plus their heart needs extra oxygen to get the job done, plus their heart is getting less oxygen because of the pathways that relate to atherosclerosis and, to get technical, the pro-inflammatory cytokines that cause this plaquing from the process of free fatty acids. So these poor people with these hearts, their heart needs more oxygen, it gets less flow because they're burning lipids, and they get less signal from the brain. Some of these people who are diabetic, when you put them on a stair, their heart rate never goes up because the stimulation circuitry, if you will, is so impacted by diabetes that their nerve tissues, to cause the contractions of the heart, are blunted. So this particular patient, obviously he's going ahead of the pack with his problem, and so he needs to get on the therapy right away.
Well, this is encouraging to hear.
Yeah, we fixed that, obviously.
Yeah. Well, thank you so much for your time today.
My pleasure.